hear all the time that incontinence is just a part of aging. I tell people, no, it isn't. I see patients, my youngest is age 4, my oldest is 101, and I believe that no one should be incontinent. There are 4 types of incontinence that I see. One is stress, and that's the common one you hear most about when people cough, laugh, or sneeze. But there are exercises that we can do to help that one. There's surgery, many different things for that one. But then there's urge incontinence, which people, you've seen the commercials, gotta go, gotta go. That's urge incontinence. We do treat it with medication, but also different things can cause urge incontinence, such as bladder irritants. And people may not think about what they're eating and drinking could make a difference in their urgency, such as milk. Milk seems very benign, but it is a bladder irritant. And a lot of people drink milk at bedtime because they feel it's relaxing. A lot of times it'll make them have the urgency, maybe urge incontinence, also can make them get up a lot at night. And then we have overflow incontinence, and that's where the bladder gets too full. It has to go somewhere, so it overflows, and that's when they're not emptying their bladder properly. So you can test to see if you're doing that, and what you do is you void. You wait a few minutes, try to void again. If you get more out the second time, you're not emptying. So you need to be seen so we can figure out why are you not emptying, and we can help that also. And then you have fecal incontinence. Fecal incontinence is the most difficult incontinence to treat. Oftentimes, because people don't want to talk about that, they stay in the house, they're hermits, they don't leave. So finally when they come in, they may have had this for quite a while. It goes a lot with constipation. And there's so many people that have constipation for years. Well, that really weakens the pelvic floor. So with fecal incontinence, I tell people you gotta get your bowels straight, whatever it takes. Now, one thing I do is tell them 3 or 4 prunes every day. Not occasionally or don't run out, but 3 or 4 prunes every day. Some say, I don't like prunes. Well, apricots, they'll work too. But do that every day, and then in the morning, most drink coffee. Drink your coffee, you wait about 20 minutes, you go to the bathroom, you sit there. Because what you're doing is you're teaching your brain and your bowel, this is the time I want you to go. You can teach your body how to do that this is the time you want it to work. It takes a little time and patience, but it really works. There's many things we can do. There's biofeedback, medication sometimes that we give. There's surgery, but the point is no one should be incontinent.